Welcome, everyone, to our first webinar of 2026. And I just want to introduce some folks on the panel today for this Living Liver Donation session. I'm Helen Hahn. I'm the Medical Director of the Living Liver Donor Program. Navpreet Kaur, who's also one of the panelists, is our Surgical Director of the Living Liver Donor Program. And Mark Sturdivant is our chief of the Division of Hepatobiliary and Pancreatic Surgery and Abdominal Organ Transplantation. Our coordinators that you don't see at this time on the screen are Anna Lily Padilla, who's our RN, Carolyn Tosios, and Alondra Romero are our LVNs. And as those may be familiar with Susan Kim, our dietitian, and Emma, who's our IOT, they will be taking over the webinar after we give you several slides on information about how to become a donor, what it takes to be a donor. But I'm going to have Dr. Sturdivant start our first few slides, and I'll continue to assist with progressing the slides. So, Mark, just give me a go whenever you.
Sounds sounds great. Thanks, Helen.
Okay.
So this will be a bit of the outline for today. We'll talk about what is living live donor liver transplant and all of the things involved with that, who can be a donor, what testing is involved, what happens during the surgery, and then also speak a little bit about what potential complications there can be and what is going to be the follow-up after donating a portion of liver. What is living donor liver transplant? As the name states, it is a liver transplant that is done where the liver portion is donated by a person who is alive. You may have heard about deceased donor liver transplant in the past, but this is a situation where the donor is living and has an operation to donate a portion of the liver and then ultimately recovers and goes home. The reason that we're able to do this is there's a unique capability of the liver to regenerate. So it's well known that we can remove actually up to probably 70 or 80% of a person's liver, and then it regenerates back to about 85 or 90% of the starting amount of the liver. That happens mostly within the first 3 to 4 weeks after a liver donation, and the regeneration is completely done by about 3 months. You can do the next slide. And then why do we need it? It would be ideal, of course, if we didn't need it and we could have enough organs to meet all the needs. There's still probably somewhere between 10 and 12,000 people on the transplant list for adults. At least back a couple of years ago, about 10,000 transplants were done. This past year, I think over 12,000 were done in the United States, but still there's a number of people who still have to wait a very, very long time on the transplant list waiting for deceased donors to become available. And every patient is quite different, but you have to hit a certain MELD score to get a deceased donor liver. So with living donation, you don't have to worry about the MELD score. You really the generosity of your donor allows you to move ahead with transplant before you get as sick as other people do. Next slide. And then there's obviously a lot of myths and facts. We're going to hit the facts first, it looks like. So living donor surgery is definitely not experimental. It's been around really since the late 80s, early 90s. The program here has been around for a couple of decades. I've been involved with it since 2004. So it's a well-established operation and way of getting transplants done. This last year, about 700 adult transplants were done in the United States. So it's about 5 or 6% of the total transplants done in the United States. In other parts of the world, it's essentially the only way that transplants were done. So I've worked at a place where 100% of the transplants are done with living donors. So it's a little bit different everywhere, but in the United States, it's not done as often as a deceased donor, but it's definitely not experimental by any means, and the outcomes are a bit better. You can do the next slide. It's one of the things that we definitely you'll be talked to early on by your hepatologist, as well as the coordinators, is the fact you don't want to wait too long if you have a living donor. So some people think, well, they'll try to go on the transplant list, see how it goes, try to get transplanted that way, and then if things get really bad, then we'll do the live donor option, and that's actually not a good strategy. In that, if you get too sick and start getting into a lot of the complications people have with liver disease, like renal failure, going into kidney failure and on dialysis, or just getting sicker in general, then living donor is not as good of an option. And you may need to have a full liver at that point. So definitely, if you have a living donor, it's best to move ahead with the transplant as soon as possible. And then that way you have a much shorter wait time. You don't get sick as much. You don't go in and out of the hospital as much. And just in general, you don't become as critically ill as some of the people do when they have to wait for a deceased donor. So the stronger you are going into the surgery, the better. And then that way, and we also know that the liver is very good quality because we've done all the testing for a liver. And at that point, the live donor transplant can be scheduled, and it allows the donor recipient to really be able to prepare for the operation. And the last thing, the main thing, obviously, people are really interested in is how well does this work? And we definitely have data now from 20 years throughout the United States and specific to USC, is that in general, living donor transplant has better outcomes than actual deceased donor transplant. The biggest, though, advantage is that you're actually able to get to transplant sooner than people with deceased donors. So it's really the best of both worlds in that you don't have to get so sick, and the outcomes after live donor transplant are as good or better than deceased donor. And then the other advantage from more of a holistic approach or a look is that by doing it this way, also we're able to use the livers in the deceased donor pool to get other people transplanted. So the donor is actually not only helping their own family member or friend, but they're kind of helping humanity in general, in that uh, others who are not so lucky to have living donors are able to get transplanted easier. And then Nav, I think you're taking over from here.
Yeah, I'm Napreet Kaur. I'm one of the surgeons here at USC as well. So you might be questioning who can be a living donor. One of the requirements is that it's a person who wants to donate, they should be above the age of 18. Um, Overall in good health. Um, that could mean, they don't have major medical problems or have had major operations or any sort of mental health illness that could get in the way of how we take care of you during the operation or after the operation, including any persistent substance use issues that could make the donor surgery sometimes difficult or sometimes unsafe in the operating room itself. And we review this and go through quite a bit of detail when you first come in to get evaluated, and see which way we can help you out if it's something minor or something major. And we usually let the donors know if that's not a if that would be an issue with the candidacy. Usually donors cannot be smoking at the current point when we are considering them for donation. And if they are, they have to quit prior to donation, um, to help during the operation itself and afterwards in the process of healing, coming off the ventilator, and overall surgery itself. So if somebody smokes cigarettes or marijuana or vaping, we will request that you stop a few weeks prior. And if somebody is obese or overweight and otherwise in every other way very good donor, we will consider you and want to potentially ask you to try to lose weight as much to the best possibility as it possible to give you the best outcome after the operation itself and the recipient with a good graft. So who can be a living liver donor? It could be a family member. It could be through your social support system, through uh, people will come forward through their church, through work, people, old friends, new friends, people through social media, people meet. Um, you will be required to take time off to recover from the operation, both during the operation and after the operation. There are sometimes costs if you're traveling across state or staying nearby the hospital. So that's something we like to tell you beforehand so you're prepared mentally. And there are programs out there that are there to develop already in place to help donors with this as much as it can be. So making a decision to donate, I think as long as you're educated, it's a very personal decision. The donor is the one who's undergoing the operation for the wellness of the recipient. So they have to understand the risk of the operation, going through the operation, going under anesthesia, and then any sort of short and long-term follow-up that might be needed to come see us back at hospital here or locally where you live. Uh, Usually, you want to understand what the process is as much as you can, and we are here to help you through the process of learning what might be required afterwards. We want you to feel not pressured by any family member or anybody you want to donate to, or feel like you're gaining anything. This is something you're doing out of the goodness of your heart for the person who's suffering with liver disease. Usually, majority of patients we come across, or donors we come across, they are family members, um, sons, daughters, nieces, nephews, brothers, sisters. But we have had extended family come through. We have had lots of friends. We have had donors who have not known their recipients, or recipients who have not known their donors. They're anonymous or non-directed, where somebody just wants to do this out of the goodness of their heart. People, co-friends, co-workers, old friends, any sort of person who you have known in the past can be a donor who's willing to get evaluated. Next slide. Um, and Living donor workup, it does require you to come visit us at USC so we could physically see you. You could go through the workup of laboratory workup and imaging for us to make an assessment if this is something doable. And at that point also gives you an opportunity of asking all the questions and visiting the site and feeling comfortable with the team and getting to know the team as well. And go through quite detail what it requires to donate, what the risk is, what the benefits are, and what the possible complications can be after the donation if there are any. Next slide.
Thank you, Dr. Kaur. I'm going to take the next few slides. So this is our team. And when you go through the evaluation process, you'll be meeting every member of our team. This is actually a photo of the whole team. I think, Susan, you're not in this photo, but this is from one of the foundation walks that we did in Santa Monica. And so that this team includes a surgeon. We have Dr. Kaur and Sturdivant in that photo. We have hepatologists, myself as the medical director, but we have Dr. Kim and Dr. Khan as other hepatologists who assist in donor evaluation. You'll meet with an ILDA, an independent donor advocate, some nurse coordinators, our social workers. We have Jessica and Angie as some of our very close social workers. As mentioned, Susan, who's our dietitian. You would, once you get through the evaluation process, meet with our anesthesiologist, speak with our pharmacist to make sure that upon discharge after donation that you're completely aware with what type of medications you'll be going home with and how that could affect or interact with other medications that you're on. And then in the process of the evaluation, you will be asked to meet with a psychiatrist depending on your comorbidities and whether you're related to the recipient or not. So, the first step in the actual process of being considered, you will fill out an online questionnaire, and it's called a Breeze questionnaire. And at the very end of the presentation, we will show you the website that you can go to and fill out those questionnaires. And on that website, you can really fill out a kidney donor questionnaire or a liver donor questionnaire. Then you'll receive a phone call from our team, and that will be one of our nurse coordinators, Anna, Lily, Carolyn, or Alondra, just checking in to make sure that you are still interested, going through some of the health and medical history. And we really encourage our potential donors to be truthful, not to hide any information, because we, as the donor team, are always looking out for your benefit as the donor. making sure that you're safe, and that we investigate all of the comorbidities that you may list, so that you have great outcomes, and that your recipient has great outcomes. So it's all confidential. We, as the donor team, do not share information with the recipient team. And our decisions are shared if whether we have a donor or not, but the details of that donor information, as well as why we are accepting the donor or denying the donor, is not shared with the recipient team. So we always start after that phone call that our coordinators make with another call from our independent living donor advocate, or our ILDA. And this person is really here to support our donor, educate the donor with regards to any questions or concerns that may arise during the early process. And we want to make sure that that the ILDA talks to you on the phone, and then when you come in for further appointments with the rest of the team, our ILDA will have a longer telemedicine appointment with our donor. And again, making sure that there's no coercion, that you're not being pressured, that you're doing this and coming forward for all the right reasons, which is that you want to help a recipient. Then after that, you will be asked to go ahead and get a blood test to make sure that your blood type is compatible with the recipient's blood type. If you're a non-directed donor, someone who doesn't have anyone in particular that you want to donate to, you want to do it anonymously, we still ask you for a blood type, so we're aware what kind of blood type you are. And if it doesn't match the intended recipient, there are ways in which we can still have you donate if you're motivated, you're still interested. There can be swap options, there can be chain options. So we really appreciate all donors coming forward and still getting the blood work done so we know where you stand. As mentioned earlier, we do a medical history, physical exam. Our surgeons do a formal consultation with our PAs in the clinics. We do psychosocial exams, of course, because there are going to be some physical and emotional changes that can happen after donation. Anesthesia becomes involved, especially in the preoperative period after we've accepted you as a donor and we're preparing for surgery. Our dietitian becomes quite involved early on to make sure that you're the healthiest you can be prior to donation, as well as our pharmacy colleagues. What does our evaluation entail aside from the blood testing as mentioned? We do x-rays, EKGs, echocardiograms. We do some stress testing, especially if you're of age where you have increased risk of cardiovascular disease. For those who are much younger and don't have any comorbidities that would put you at risk of heart attack, stroke, things of that nature, we may just ask you for a plain echo. Mark, you can take it from here. Oops, go ahead.
Sounds good, thanks. So part of the evaluation, of course, is going to be imaging of the liver. So this is the top picture is a CT scan, and the bottom one is an MRI. What we use that for is to look at the blood vessels, and then we also are able to check the size of the liver. The most important thing is that we always leave at least 30% of the liver with the donor. So just a little bit under a third of the liver has to stay with the donor. And everyone's liver is made up a little bit different. So these tests are really important to make sure we understand what your liver looks like. The bile ducts or the MRI tells us what the bile ducts look like, which is important for our surgery planning. And then it also tells us how much fat is in the liver. And the MRIs are pretty sophisticated now, so we very rarely have to get liver biopsies like we used to have to do. And we'll remind you many times during your evaluation that this is all voluntary, and we definitely encourage donors that if they at any time don't want to continue, or just let us know and we can stop the evaluation. And again, we keep that as confidential as we talk about at the beginning of the process. So anytime during the process you want to stop, then just let us know. As far as the medical insurance aspect of this, of course, expense always is on the minds of people, but all the donor workup as well as the operation itself and the follow-up is billed to the recipient's insurance company. It's actually much cheaper to actually do this operation with a living donor. So it's kind of a win-win, but we definitely do everything we can to make sure there's no expenses billed to the donor. And then as far as confidentiality, I think Helen touched on it a little bit earlier, but everything is done. Your doctors and nurses who follow you and do your evaluation, they're all donor team members. So everything is done on your behalf to make sure it's a safe process, and all the information none of the information will be shared, but to the recipient team. And that really allows you to go through it. And sometimes the donors don't even tell the recipient they're being evaluated until they've had a chance to make their decision. And then the last thing we like to talk about is occasionally when people can't be a donor, we always encourage them to be what's called a donor champion. So people who are trying to find a liver donor oftentimes need help because it's kind of sometimes an awkward conversation to have, or you just obviously this is the first time you've ever done this. So we really try to help people utilize their voice, utilize social media to tell their story, reach out to family and friends, and we also can give you some ideas on how to have those conversations. One of the things that you can always rely on is to be able to go to our website and get information at usclivingdonor.org, as well as our toolkit, and that will give you some ideas on how to potentially find a donor, because of course a lot of the times you won't have one at the time of your visit, and we'll do the best we can to help you with doing that. And I believe that is the end of the presentation.